Is apathy genetic? Have you ever wondered why some people seem to lack motivation or interest in activities they once enjoyed? This feeling, known as apathy, is often seen in individuals with schizophrenia. But is there a genetic link to this symptom? Let's break it down. Apathy is defined as a lack of motivation, interest, or emotional expression. In the context of schizophrenia, it is considered a negative symptom. Schizophrenia itself has a strong genetic component, with estimates suggesting that genetics account for 70 to 80% of the risk of developing the disorder. This means that many genes, along with some rare genetic variations, can influence brain development and neurotransmitter systems involved in schizophrenia symptoms, including apathy. However, when we look closely at the relationship between genetics and apathy, the evidence is not as straightforward. Research has not found a strong link between common genetic variants associated with schizophrenia and the levels of apathy experienced by individuals. For instance, polygenic risk scores, which summarize the cumulative effects of various genetic variants, do not predict how severe apathy will be in patients with schizophrenia. This indicates that while apathy is a common symptom in schizophrenia, it may not be inherited through the same genetic pathways that increase the risk of developing schizophrenia itself. Instead, apathy may be influenced more by clinical factors, environmental conditions, and psychological aspects rather than solely by genetic factors. In practical terms, this means that addressing apathy in individuals with schizophrenia requires a broader approach. Treatment should not only consider genetic risk but also focus on environmental influences, psychological support, and clinical interventions. These strategies can help reduce apathy and improve overall functioning. So, while apathy is indeed a symptom associated with schizophrenia, it is not strongly linked to genetic factors on its own. It is more likely a complex symptom influenced by a mix of genetic vulnerabilities and other biological, psychological, or environmental factors. Understanding this can help in managing apathy effectively in those affected by schizophrenia.